Do you feel discomfort when climbing stairs, bending, standing up, or even just walking? You're not alone, and you don't have to live with it forever. Even if you have osteoarthritis, past injuries, or years of stiffness, there is a way to restore strength, stability, and move freely again. It's not only about doing exercises, it's about retraining your muscles, improving hip and ankle flexibility, and learning to spread the effort across the whole leg. Often, the real issue isn't the knee itself, but built-up tension, weak spots, or habits like poor sitting and walking posture that slowly wear the joint down. That's why, along with strengthening your thighs and glutes, you should spend a few minutes each day on gentle stretches. Use ice after activity to reduce swelling, and heat during rest to relax tight muscles. Most importantly, pay attention to your body's signals. With small, consistent changes, you can ease pain and regain confidence to move without fear. In this video, you'll learn 2 safe, effective knee exercises. Smart recovery tips, the forgotten method to fully engage your quadriceps, and natural ways to relieve pain. No pills, no surgery. No matter your age or fitness level, you can walk, run, and stand with ease again. And the journey starts now. Exercise 1. Isometric lunge. One of the main reasons people experience knee pain during workouts isn't always heavy weights or high intensity, but rather poor form even in exercises that seem simple, like isometric lunges. A common question is, how can I do isometric lunges without causing knee pain? This concern is completely valid. When the knee experiences slight shifts, uneven pressure, or misalignment, the risk of irritating the patella, inflaming tendons, and wearing down cartilage increases significantly. Scientific studies explain that patellofemoral pain is often less about structural cartilage damage and more about faulty movement patterns and muscle imbalances between the quadriceps, glutes, and hamstrings. That's why pushing through the pain or adding more repetitions isn't the solution. The key is mindful execution, training the muscles to work together in a balanced way, protecting the joint, and avoiding concentrated stress in one area. When done correctly, the isometric lunge is an excellent example of a functional exercise, supported by research for strengthening the lower body without the impact that worsens conditions like osteoarthritis or patellar pain. To perform it safely, step into a lunge position similar to holding a long stride or a yoga warrior pose. Keep your chest upright, back straight, and core muscles engaged. This is crucial because the deep stabilizing muscles of the core help keep the pelvis steady, preventing the supporting knee from collapsing inward, a common mistake called valgus collapse. Hold the position for about 10 seconds, making sure your weight is centered over the middle of your foot. If you place too much weight on your heel, the work shifts almost entirely to the glutes and hamstrings. If you lean too far forward on your toes, you overload the patellar tendon in the lower portion of the quadriceps. Biomechanical research has shown that balanced weight distribution greatly reduces joint stress and spreads the workload across the entire kinetic chain of the leg. One valuable tip and a major benefit of the functional approach is to use supports if you feel pain or instability at first. A wall, walking stick, TRX straps, or even a door frame can help. Over time, you can gradually increase the holding time or add light resistance, such as dumbbells weighing 1 to 3 kilograms, to keep making progress. The ultimate goal is for this position to act not just as an exercise, but as neuromuscular training that teaches your quadriceps, glutes, and hamstrings to work in harmony. Since isometric exercises involve minimal joint movement, they protect cartilage and prevent repetitive microtrauma, making them especially valuable for people with early-stage osteoarthritis or patellofemoral chondropathy. The benefits go beyond the quadriceps, as it also engages the glutes, lower back, and core, all of which are key for aligning the hips and stabilizing the knees. Isometric lunges, when performed with awareness and proper technique, are one of the simplest yet most effective ways to begin building knee strength and confidence again. Exercise 2. Wall sit. The wall sit is far more than just standing still with your back against a wall. It's a science-backed method for safely activating and strengthening all the muscles that protect your knees, even for people dealing with osteoarthritis, past injuries, or muscle weakness. Unlike a traditional squat, which involves repeated bending and straightening of the knees, the wall sit uses isometric contractions, muscle tension without joint movement. This is important because, as biomechanical studies explain, keeping the knee still reduces patellar compression and minimizes the risk of small injuries to tendons and ligaments. To perform the exercise, Stand with your back against the wall and slide your feet forward until your knees are directly above your ankles. Avoid letting your knees go past your toes, as this can overload the patellar tendon. Keep your weight centered over the middle of your foot, not too far on the heels and not too far on the toes. This detail matters. Shifting onto the heels puts most of the work on the glutes and hamstrings, while leaning forward onto the toes places too much tension on the patellar tendon in the front of the knee. Start by holding for 20 seconds. Then, instead of forcing extra weight or unnecessary motion, progress intelligently, gradually increasing the time or number of repetitions. Research by Supnitsky found that isometric training not only protects cartilage but also improves eccentric strength. This is a crucial skill for activities like walking, descending stairs, or playing sports without injury. One reason the wall sit is so effective is that it's easy to adapt. For example, to target the outer hip muscles, place a resistance band above your knees and gently press outward. This helps reduce inward knee collapse, known as valgus collapse, common in people with osteoarthritis or patellofemoral pain. To strengthen the inner thigh muscles, place a ball or block between your knees and press inward lightly. Strong adductors also help stabilize the joint. Another big advantage is that the wall sit can be performed by older adults or post-surgery patients. The upright position also encourages good hip and spine alignment, strengthens the core, and helps prevent lower back pain caused by leg muscle imbalances. The wall sit also builds muscular endurance, the ability to hold a contraction over time, which is more relevant to daily life than short bursts of strength. It's a simple exercise you can do at home, at the office, or even while watching TV, eliminating the "I don't have time" excuse. Just 10 to 15 minutes a day, combined with proper form, full extension work, and recovery, can protect your knees for years to come. You don't have to be a professional athlete to keep your knees healthy, you just need consistency, awareness, and smart training. If this information is helpful, please give the video a like, share it with anyone struggling with knee pain, and subscribe for more science-based, practical tips to help you move freely and live without pain.